All right, let's dive right in. I want you to imagine your body is this huge, complex water system, and your heart? It's the main pump. So what happens when that pump starts to get tired? Well, it doesn't just stop. It struggles, it strains, and the whole system starts backing up. That, right there, is heart failure. Today, we're going to take a journey from the root of the problem all the way to the life-saving fixes. So welcome to the Heart Failure Masterclass.
And to make this all real, we're going to follow a patient. Let's meet Mr. Chen. He's been feeling way more tired than usual, he's short of breath, and his ankles are all swollen. Basically, his heart is sending out a major SOS, and our job is to figure out why and what on earth we can do to help him.
So, what is heart failure, really? Well, the most important thing to get is that it's not some one-time event. It's a progressive condition. You can almost think of it as the final stop on the line after years of damage from things like a heart attack or just chronic high blood pressure. But the bottom line, it's simple. The heart just can't keep up with what the body needs.
Now, not all pump failures are created equal. For a patient like Mr. Chen, his problem is going to fall into one of two main buckets. So let's break down the mechanics of what could actually be going wrong inside his chest.
Okay, so you've got two main culprits here. On one side, you have systolic failure, what we call HFrEF. Think of this as a squeeze problem. The heart muscle itself is weak, it just can't contract with enough force. Then, on the other side, you have diastolic failure, or HFpEF. This is a filling problem. The heart is stiff, it squeezes just fine, but it can't relax enough to let the blood in. So you get the same outcome, less blood getting pumped out, but for two totally different reasons.
Now, here is the absolute crucial point. When the heart's output drops, the body doesn't just sit there and take it. No, it tries to help. But in this really cruel twist of irony, its attempts to fix the problem actually create this vicious downward spiral that makes the heart failure get worse and worse over time.
Let's just walk through this disaster cascade. So, it all starts with some kind of injury that reduces cardiac output. Then, the body completely panics. It activates two major panic systems, the RAAS system, which controls blood pressure and fluid, and the sympathetic nervous system, our fight-or-flight response. Together, they jack up blood pressure, they make the body hold on to fluid, and they tell the heart to beat faster and harder. And yeah, short-term, that helps. But long-term, this constant stress literally reshapes the heart muscle in a process called ventricular remodeling, making it bigger, weaker, and way less efficient.
And that right there, that's the core challenge. The body's own survival instincts become the enemy. The very systems designed to save it are now driving the disease forward, leading to those classic symptoms like Mr. Chen's shortness of breath and swollen ankles. Our entire treatment strategy is built around one thing: stopping this process.
To understand the pharmacology, check the top right corner. On your screen, a video will pop up there.